One of America's largest health insurers, Anthem Blue Cross, is under fire for refusing to help New York City crack down on soaring healthcare costs, according to Rich Calder, published March 23, 2025 in the New York Post. NYC hospitals are charging patients sky-high prices. And the Big Apple's largest public employee insurer, Anthem, who processes those medical claims, strangely is refusing to turn over the data. The city's Office of Healthcare Accountability says hospital prices are wildly inconsistent. Anthem paid on average $45,150 for hospital inpatient services last year at New York's top 10 hospital systems. But the highest prices were at New York Presbyterian, $92,727, Montefiore Medical Center came in second, $83,573, while Stony Brook University Hospital was the lowest, $36,876. Why is Stony Brook $55,000 less expensive for inpatient care than New York Presbyterian? The report noted NYC spent $3.3 billion paying for employee hospital care last year. Who got that money? Well, half of it went to just 3 hospital systems: Northwell Health, New York Presbyterian, and NYU Langone Health. Northwell $759 million, New York Presbyterian $485 million, and NYU Langone Health $443 million. So what do prices look like? Well, New York Presbyterian had the highest prices for 11 out of the 12 inpatient procedures analyzed and 14 out of the 27 outpatient procedures, the report said. Prices at hospital systems ranged widely, for a colonoscopy from $942 to $12,000 for the same procedure. Prices for a cesarean section ranged from $7,000 to $58,000. And listen to this one: the city is now spending more on hospital outpatient care than inpatient care. The city pays Anthem a whopping $3 billion yearly to insure 900,000 employees. The report cited Anthem for refusing to provide the data on the full cost of the healthcare to determine whether the prices were warranted. Anthem claimed that releasing the pricing data would violate confidentiality agreements it has with hospitals, but Councilwoman Menin isn't buying it. Besides, there is a 2021 federal law requiring hospitals to disclose their prices to the public. The Councilwoman sponsored legislation in 2023, creating the first-of-its-kind OHA healthcare watchdog office. This healthcare industry cat-and-mouse game is costing the city billions, and we need full transparency now. Why should New York City be paying so much for healthcare? It's sickening and unsustainable. The city's healthcare insurance contract with Anthem is up later this year, and guess what? Anthem is among the bidders for the new deal. The city must require full disclosure of pricing from whoever gets the new contract, said Menin. The Big Apple could save taxpayers as much as $2 billion annually by auditing payments and making recommendations on ways to lower the prices. It's clear that hospitals and insurers are still exerting their influence to block sharing certain data the city needs to reverse the trend of exorbitant healthcare costs, the union said. Health insurance companies and New York City hospitals must remove arbitrary barriers to data access that would otherwise support transparent and equitable pricing of medical services, said Henry Garrido, executive director of District Council 37. Anthem representatives did not immediately return messages. As a follow-up to Rich Calder's article, now a week later, Anthem has finally agreed to release the healthcare data related to the $3.3 billion of spending. Perhaps Anthem wants the new contract. Does the health data even belong to Anthem? Or does it belong to the members in the city? It seems NYC needs help in cracking down on these escalating healthcare costs. If the OHA wants our help analyzing that new healthcare data from Anthem, please visit our website at finhealth.com. We save employers millions of dollars a year mitigating fraud, waste, and abuse in healthcare spending. Our email is sales@finhealth.com.